Anjana, welcome to the session. Welcome to the webinar. And just to introduce her, Anjana Rajendran is a psychotherapist. And she's a coach in our 2-month online Vaginismus healing program. She's been there with us for 2 years now. And it's been a fantastic journey that I've had with her. Her success rates are really good and they are just going up. So I thought today is a good time to maybe interview her and also gain some insights from her story or from her work in the program. So, welcome, Anjana. Thanks a lot for being here.
Thanks a lot for introducing me and making me part of this. Very excited to be here.
So, Anjana, let's start off by understanding how did you think of joining us and working on vaginismus? Because not many people know about this condition and not many people have been even exposed to the cause.
Hmm.
So, how did you think of joining this program and what has been roughly your experience so far in the last 2 years?
True. Like you said, right, this condition itself has so much, like there's a lack of awareness is truly so sad because even before I joined the program as a therapist, I even didn't know about vaginismus. Like I remember reading about it the first time when I came across Proactive for Her, their website, their opening. Then it was like a dream come true because I realized I could work with people who are struggling with their mental health, but also with their sexual health. Growing up, I think I was very aware of the lack of, sexual education, the way that our sexuality is suppressed, and I've always hated it, and I wanted to be in the center of that, where I help women, embrace their sexuality. I think every time I see and work with women like that, it's almost like, seeing a caterpillar bloom into a butterfly every time they explore and embrace their sexuality. And it's been like around 1.5 years working, and it's been amazing. It's been like one of the most biggest privilege I've had, like navigating these folks, like the healing that these people have, not just as a physical condition, but as something that actively affects their emotional health, their well being, their relationships, their sense of self. Because, like you mentioned, it comes with immense shame, immense, guilt that am I doing this to myself? What am I doing to my partner? Right? So, every day I witness such quiet strength and resilience that women walk in with, despite the confusion, the isolation, the fear, the shame, and feeling that it was their fault. Despite that, they show up to heal. I think that has been the biggest inspiration for me to continue working. And like you said, vaginismus is often very misunderstood. So nobody knows what's going on, right? Nobody knows what exactly is the culprit or the root, other than just blaming the person. So I think the biggest surprise about this program for me was that I'm not just working alone as a therapist. I'm working in a team of different experts, gynacs, physiotherapists, yoga practitioners, psychiatrists. Like we all come together, including a pleasure coach. We're all coming together and helping you. It means that we are not just addressing your symptoms, but we are supporting you as a whole. We support your body, your mind, your emotions, your sexuality itself, right? And I've seen that every woman's story is very unique. It is very,
Yeah.
challenging, difficult, but we hold space for it all.
Wow. Wow. Anjana, you speak so well. Thank you so much for putting that across. I always say that uh, when you heal the tree, let's say there is a pest, like there is a pest on the tree. Do you
Hmm.
just go and clean the branch? You don't, right? You
Yeah.
maybe you also prune the branch, but you put a lot of pesticide or whatever herbicide in the root, right? So you heal the whole tree to be able to heal the leaf. And this is exactly what we do. It's a root based approach in our program where we heal the person. And the
Right.
person comes with emotions, the person comes with relationships, and the relationships could be not just with the partner, but with parents, with teachers, with friends. So the relationship with the world, relationship with people, relationship with herself and her own sexuality, right? So it's a whole person approach, and that is a huge thing to do in 2 to 3 months, right?
True, absolutely. Yeah. Yeah.
Fantastic.
It's not just me working alone. I have so many people, a team of therapists. I know that if I am confused with a client, I know exactly where to send them. They are never alone.
Great. So now I think people would be very, very interested to hear from you some success stories that you have come across or cases that you have worked on. and they were successes, I think that would be a real time understanding of how vaginismus healing feels like. So why don't you go ahead?
Right. So I think I've worked with so many clients now, so I had to like sort of pick and choose the success stories that I know will, really relate with a lot of folks. I think the first person that I'd like to talk about is this 31-year-old woman who came to us when her libido was so low. She wasn't even trying to engage in sex. For her, it was all about conception. Like, I just want to conceive. Everyone around me has a baby. When will I do it, right? And she came to us. She was actually married for the last 2 years, but she had dated her partner for 4 years. And in those 4 years, she and her partner both had some taboo surrounding premarital sex, so they never tried having it, right? But the first time they
Isn't
tried it,
that isn't that such a pain? Because
yeah.
people avoid premarital sex to only do it after marriage, and suddenly after marriage they realize they have vaginismus. Isn't that such a shame?
Exactly.
Right?
It's so
Go ahead.
heartbreaking to hear that. Yeah. Just like that, like it was so heartbreaking for her because in her honeymoon, she was looking so forward to it. So her and her partner, and suddenly, she was aroused. It was great. There was great foreplay, but the penetration didn't happen. It felt like a tearing pain. She was very confused. What is that happening? And then she felt like maybe I'm tired by the travel. Then they kept trying again and again. It was always unsuccessful. Eventually, they stopped trying, and there was such a huge distance between her and her partner as well because they couldn't figure out what's going on. And she had such an intense blame that she was carrying with herself. And apart from this, I think one of her biggest fear was that her elder sister also had vaginismus. But her
Oh,
sister did not get any sort of care. They didn't know what to do about it. So when it came to having, like, creating a family, her sister went through multiple IVF, all of that. And we all know how IVF can be very demanding, very exhausting to the mind and body, even financially. So she saw her sister go through multiple complications and she was very scared that she herself will go through it. So when she came to,
yeah. Just before you go ahead, I just want to clarify to everyone that vaginismus is not genetic. It doesn't run in your genes, but it definitely runs in the culture. And so, two girls in the family will be exposed to the same culture, and there is a high probability of sisters and aunties having the same condition. So that's just
true.
wanted to add that. Go ahead. Go ahead.
That was exactly her case. They both had been through so many situations together surrounding shame about their sexuality. So that when she joined our program, we went through a lot of emotional healing, but most of it was to bring back hope in her, let her know that this can be healed. And 3 months into it, she's healed and she's recently conceived. She's now pregnant. And it
Oh
was
my
natural.
God.
She
Oh
never
my
had to
God.
go through
Wow.
IVF. Yeah.
Uh, the IVF wasn't needed. This was natural
No,
pregnancy.
not at all. Yeah.
And how many months after the healing did she conceive?
I think she conceived within 4 to 5 months.
Wow, fantastic. How does that feel for you as a coach?
Very good. I was so happy to see that her fear was not manifested because she was extremely scared to walk through the path that her sister took, but she didn't have to.
And how many weeks did she take to heal?
She took around, like I said, she took around 3 months. Between there were breaks because she was tired or she was ill, but then she went back into it. I always pulled her back with a lot of motivation, a lot of reassurance. I think the support groups really helped her because she saw that she was not alone. There are other people also who would push her as an anchor.
Yes, and the average time to heal is between 2 to 3 months. And a lot of people ask me, then why is your program 2 months?
Hmm.
2 months is when a lot of women do heal, but some people can take more than 2 months, and we do have a program for them also, and we do have a structure for them also. But yes, if you persist, 2 to 3 months is when it will be done. Okay, so this is a beautiful success story that you had.
I have more I can share. Like I remember
Yeah, right. Go
this.
ahead.
I think this will just sort of fit with most women here because in India, like there's way that our sexuality is suppressed, right? Like you always said that how we are told to suppress our sexuality, almost be asexual for the first like 30-25 years of our life, and then suddenly we are supposed to switch after marriage. I met exactly like a woman like that who came with a very conservative background. She never knew anything about sex. She hadn't even looked at a man properly. I still remember her telling me that the first time I looked at a man from head to toe was at the first night of my marriage, and I was very terrified and scared. I didn't even know that the penis was supposed to go inside the vagina. I was so scared. She didn't know any basics about
And you
sex,
know
and
what?
that
I just
was
wanted to share that this is exactly what a client of mine shared in the previous group, that she had no idea that penetrative intercourse is actually about penetrative intercourse. She thought that somehow the two organs meet and then there is a baby, right? And this was an engineer, right? A science student. So that just tells us that our biology lessons start from the cervix above. We just talked
absolutely.
about the uterus and the fallopian tubes and the ovary. There is nothing, there's no discussion about what happens below the uterus. Yeah, go ahead.
Absolutely. And even when they do talk about it, it's like don't have sex. Have it after marriage. Right?
And they
So
say that if you have sex, you'll get an STD. If you have sex, you will have a baby. So use condoms, right? So it's a very negative way of talking about sex that generally it just scares you maybe more than empowering you.
absolutely, yeah.
Go ahead, go ahead.
So, like I said, this woman, she did not have any idea about the basics or the anatomy. The society had failed her into not even understanding what sex means, right? Because it's so basic, it's so natural to us. So, I remember the first few weeks of our program, I spent hours explaining to her just the basics of sexuality. How does a vulva look like? How does sex work, right? How does masturbation work? Which was such a new thing to her. She didn't even know that women can masturbate, right? And within 4 weeks, she went from not even being scared to being so scared that she couldn't even touch her vulva, right? Anywhere around the opening. And within 4 weeks, she could insert her first dilator and she also had an orgasm. And that was so mind blowing for her. She never knew what an orgasm means, and she had it for the first time, which was so like so amazing for me to hear. And she healed within 8 weeks. For her, it was
Wow. So
absolutely
she went
possible.
from there to there in 8 weeks.
Exactly.
Fantastic. Wow. Hats off to you.
Yeah, hats off to the whole team. We all did it together. Yeah,
And I think hats off to the process. The
absolutely.
four-step formula is like the spine of our program. And I always say it's like a formula, two into two is always four. So if you just apply the four-step formula just the way it's designed, there is absolutely no reason why you're not gonna get the same result that these 640 plus women have received, right? Great.
Absolutely.
Very,
Yeah.
very happy to hear these two success stories, Anjana. So now I would also like to ask you that in these 1.5 years of being with us, have you had some insights about the treatment process or about the program that you wish to share with our 93, 94 clients here?
Absolutely. I think that's a great question. These are things that I've always carried with me. I've always wanted to say it out loud, right? For especially women who are just deciding whether to join or not. I think for me, what I've realized, I think also you, something that I share with you is that emotional healing is very important. I think a lot of folks who come to us, they might feel like this is just a physical condition. I just need to get through dilators or just need to, get through the pain and get done with it. No, it's more than that. Your sexuality, the way that your body opens up to someone else, is very much influenced by your mental health. What is held in your subconscious about your own experience of sexuality, about pain, about what you feel about sex, right? How you feel about men. All of it contributes to it, including the messages you've heard from the society, right? There is a reason why your brain is like, we will not let anything go inside, because your brain is terrified. It is setting with a lot of fear. And to move through that fear, we need to emotionally heal. That is what I think sets us apart from every other like other programs or other people who treat vaginismus, right? I think we've had a lot of screening calls where people have already tried other things, like they've been through physiotherapists, they've been through dilators, but still they are not able to have sex with their partner.
We've had people who have completed their last vaginal dilator but not able to penetrate. And all they had to do was go through emotional healing and everything, two plus two became four.
Exactly. Yeah. I think we recently had a screening call like that. I think she's your client from this batch, right? She's gone through all the 5 dilators and still she's not able to have penetration with her partner because there's something there in your mind, deeply embedded in your mind, and it requires healing.
Fantastic.
Yeah.
That's the
I
first
think
point. Emotional healing is important.
Absolutely. And I think the other thing is prioritizing this. I think because of, I don't know if this is a South Asian thing, probably it's very much in India, especially where we don't give a lot of importance to anything that concerns our mental health or our emotional health, right? If we get a fracture, if we get some sort of physical issue, we are so quick to run to the doctor, take a leave, take a 1 month off. We'll do anything to step aside from other engagements in our life. But when it comes to emotional health, we feel stuck. We are like, oh, do I even want to do this? Do I even have to go through it? Right? So a lot of folks who join us, we really tell them that this is a commitment, this is an intense program. You deserve to go through it when you have the time, the space, and the emotional, bandwidth to sit through it all. That is what you deserve. If you had a fracture, would you still work, still go to office like usual? No, right? You will take some step back. So if work is something that's stopping you from healing, if there's something else, I would really suggest that you look into prioritizing this. This is affecting your sense of self, your relationship, your own sexuality with yourself, right? It requires the same commitment as you would give to any physical health concern.
And we are learning, right? There is a lot of learning that goes on in the program, and you're learning about your vulva for the first time, orgasms for the first time, you're learning about vaginal penetration for the first time. There is so much that you learn for the first time. And we are not asking you to leave work. We are not asking you to quit. But we are just saying, if you have four burners in your gas, put it in the back burner. Let vaginismus be in the front burner, right?
Absolutely. Yeah, exactly. I think this just reminds me of one case. I think one of our past coaches, they had a client heal within 2 weeks, and all they needed was to just hear the facts and the myths. I think one biggest myth in her mind was the hymen, that hymen
Yeah,
is causing a huge block, right? And once she knew, it was done. Like her mind was safe. It was out of that feared state.
totally.
Right. I think after that, I'd like to say that, this isn't just about your sexuality. Vaginismus is much more than that. Of course, having penetrative intercourse can be an excellent goal, but we've had women who come to us, they're like, I cannot put a menstrual cup in. They might have a lot of physical concerns, which requires them to go through a lot of treatments, a lot of pap smears, TVS scans where they put a probe inside you for ultrasound, right? They are terrified. They scream in front of the doctors. They are shamed for even not being able to go through it. These women just want to get through these experiences. PIV or like having penetration can be something that's later, right? So healing vaginismus is not just about having sex with your partner. It's also about experiencing your own sexuality. It's about
It is a
going through.
lifestyle. It's a lifestyle issue, right?
Exactly. It's a lifestyle issue. It's much more than penetration. It's painlessly going through those checkups, not having to fear these checkups, being absolutely comfortable inserting a tampon or a menstrual cup. It is what you want it to be.
Wow. So you said priority. You have said, what was the first one?
Emotional healing.
The importance of emotional healing, importance of priority, and realizing that vaginismus is a non-negotiable problem. It's not a problem that you can put off and say, I'm going to be without penetrative sex. Yes, you can be without penetrative sex, but can you be without a pap smear? Can you repeatedly avoid vaginal exams by doctors in case you have some issue? So this is a life. Yes. And
Absolutely.
I would like to ask you about support groups. A lot of people are not exposed to support group culture in India, right? We generally
Right.
are used to just going to OPDs and just seeing patients like doctors on our own. So when we have a separate women's support group and a separate men's support group, why do you think that's so important to heal?
So I think that's a great question. I think to answer that, for some time, I want all the women or all the folks who are hearing us to just ask themselves, how many people around you have you told this about, that you're finding this difficult? Apart from your partner, does anyone know? Barely some people know. We cannot even go to our parents or our friends with this, right? That itself is the testament to the fact that these support groups are very important. It is a very powerful part of the healing journey because our support groups are very safe, they're confidential. A lot of women, they're coming together, they feel seen, they feel heard, understood, they feel that they're not alone, right? And the thing is, these groups are taken by, like I said, a whole team, gynacs, physiotherapists, other therapists, pleasure coaches, right? They will come in and guide you in every single angle, not just about penetration, but also about why can't you feel pleasure? Why am I not able to even have the desire to be be intimate with my partner, right? They will look at everything. And I think every support group sort of focuses on different themes. Like first we have something that, understands about pleasure, about emotional blocks, about navigating intimacy with your partner, right? Or even about body awareness. It's a lot of different themes that we follow. But just as importantly, it's a space to listen, to connect, to hear other women who have this, right? I think most of our clients have always told us that these support groups made them feel like they are normal again. They are not broken. They can be healed,
The
right?
shame just left their body is what I think the words that were used by most.
Absolutely.
Fantastic.
Absolutely right. Yeah, it's the connection with everyone else
Then
that
why
brings
would
them.
you say the men's support group is important? Why would the partners join a program that technically belongs to women? Of
Right.
course, we have separate support groups. We don't have overlaps.
Right. So I think even with partners, right, a lot of these partners are also sitting with a lot of misconception. They also don't know how vaginismus works. They've also been told that women are supposed to feel pain when she has sex. Let her go through it. She should feel it. If she's my wife or my partner, if she loves me, she has to go through it. That's not the case. They are also sitting with a lot of myths, a lot of misinformation.
Sometimes they feel that she's not trying hard enough. Sometimes they feel, does she love me enough? Is she interested
Yes.
in me? And of course, if pain is how it is. I mean, that's the rite of passage. We just have to go through that. Or is she being too weak? Right? So initially, I think most men are very supportive, but as time catches on, I think the
Absolutely.
frustration builds in. And so the partner support group really helps to help them understand that the woman is not doing this on purpose, and how can he support her, and of course dealing with his pain as well, right? A lot of his pain is all also addressed in the program.
Absolutely. I think those men also get like a safe space to just express and vent that, see, this is what I've been through. I felt that I'm not loved. I'm rejected. So these men also have like a space to vent it out. There's also a man who's going to listen to them, a man who's been in similar shoes. Like the person who takes our support group for the men, it's Dr. Dharav, right? It's your partner who's been on their shoes. I think that can be very reassuring for them. And they can, in fact, help. Like, I think hearing from Dr. Dharav how it is a normal condition, how it can be healed, like their voices are heard, it can actually push these men to encourage their partners to heal, even support them. It's not like they are going to walk ahead of these women, push them, or walk behind. They will walk right with you when they have a support group and they know that it's okay, that this can be healed.
Fantastic. I think you have covered some very important points. And I think that those insights would really be very, very useful for everyone here. At the end, I just would like to ask you if there is a message that you'd like to give out to these women here, what would that be about vaginismus healing?
I think before we end, like, definitely to every one of you who's either, if you're diagnosed, if you're considering, do I even have vaginismus, or if you're simply trying to understand your body, just know that you are not alone and you are not broken. This is not something that you're doing to yourself or your partner. This is something that is happening to you. Like, you wouldn't blame yourself if you had asthma, right? And you cannot tell yourself to just breathe. It's not going to happen. It is not something that you're going through. It's not something you're doing to yourself. It needs treatment. It takes time, but every step counts. And your courage, your resilience, the fact that you even showed up to this webinar, that itself is a first step to a very powerful healing journey.
Wow, wow. And one day, even an asthmatic, if he's totally healed or she's totally healed, will be able to do just breathe. So, similarly, you will also be able to just penetrate without thinking. So, that day will also come.
Absolutely.
So, thanks a lot, Anjana. I think your sharing was very powerful.